Everybody, and welcome to this afternoon's virtual congressional briefing. My name is Catherine Majeski, and I'm the Manager of Government Relations for the PA Education Association, and I'm really grateful to have you all join us today. I did want to just begin this afternoon's session with a few housekeeping points for your awareness. So at the top of the screen, you'll all have viewing options that allow you to exit full screen view and see side-by-side views depending upon your personal preference. If you have questions at any point during the presentation, please submit them in the designated Q&A box below. We will be answering all questions at the end of our presentations, but you can submit them in real time just so they're already there. And with that, I'm really pleased to hand it over to Michael Roscoe, PAEA's president, for his opening remarks.
All right. All right, welcome everybody. Good afternoon, and thank you for taking the time to join us today. On behalf of the PA Education Association, I want to thank the many congressional offices represented on this briefing for your interest in the future of health workforce and in the patients and communities who depend on it. Again, my name is Mike Roscoe, and I serve as PAEA's president, as well as a program director for the University of Tampa PA program. Today's discussion, Rural Healthcare on the Brink, Federal Student Aid, and the Future Health Workforce, focuses on policy changes that may appear technical at first glance, but carry significant consequences for the nation's ability to educate and deploy clinicians where they are most needed. Physician associates, or PAs, are a critical part of the American healthcare workforce. There are more than 178,000 PAs that are practicing across the country, delivering high-quality care, team-based care in primary care offices, hospitals, community health centers, and in rural clinics. PAs help expand access to care, reduce wait times, and ensure that patients can receive timely treatment in their own communities. In rural health areas, this role is especially vital. Rural communities face persistent shortages of health professionals, higher burdens of chronic disease, and longer travel times for care. PAs help close those gaps, and many PA programs choose to practice in underserved and rural areas. And PA programs across the country are deeply committed to training students who will serve those communities. But the ability of PA programs to educate that workforce depend heavily on the federal student aid. Recent changes to federal student loan policy affecting professional student designations have created uncertainty for health profession programs, including PA programs, about how will students finance their education. For many students, federal loans are the primary mechanism that makes PA education possible. Without reliable access to those resources, programs may be forced to reduce enrollment, and prospective students, especially those from rural or lower income backgrounds, may find the door to health profession education closed. If that happens, the effects will be felt directly in the healthcare workforce pipeline and ultimately in the communities that are already struggling with the most to recruit clinicians. That is why HR 6718, the Professional Student Degree Act, is so important. This legislation would restore clarity and stability to federal student aid policies for professional graduate programs like PA education by reaffirming that these programs qualify under the professional student designation as Congress mandated in the One Big Beautiful Bill Act. The bill ensures that students preparing for essential health professions can continue to access the federal loan programs that make their education possible. We are grateful to the members of Congress who have already chosen to co-sponsor the Professional Student Degree Act. Their leadership recognizes that workforce policy and student aid policy are deeply connected, and that protecting one helps sustain the other. For offices that have not yet joined as co-sponsors, we hope today's discussion will help illustrate why this issue matters not only to PA programs, but to patients across the country. Ensuring that students can pursue careers in healthcare is one of the most practical steps Congress can take to strengthen the nation's workforce and safeguard access to care in rural communities. Over the next hour, you will hear from experts in PA education and workforce policy who will discuss how these student aid changes affect programs, students, and the communities they ultimately serve. We hope this conversation provides useful context and informs your work as Congress considers solutions. Thank you again for joining us today and for your commitment to policies that support both the healthcare workforce and communities that depend on it. And with that, I'll turn this back over to Tyler Smith to begin our discussion.
Great. Well, thank you, Mike, and good afternoon, everyone. As Mike mentioned, my name is Tyler Smith, and I serve as the Chief Policy Officer at PAEA. Today, I'll be walking through how we arrived at the current dispute regarding the definition of professional students and steps that Congress can take to ensure that all students that meet OBA's definition have access to the aid that they need to address workforce shortages. To understand the issue, it's helpful to start with how PA and other health profession students have traditionally financed their education. Historically, students have relied on a tiered federal loan system. First, they could access unsubsidized direct Stafford loans, which have had an annual cap of $20,500 and carry a relatively lower interest rate when compared to Grad Plus loans as well as loans in the private market. Beyond the unsubsidized direct Stafford loan option, students could then utilize Grad Plus loans, which allow borrowing up to the full cost of attendance minus any other aid they receive. Under federal law prior to OBA, there was no meaningful distinction between different types of graduate or professional programs when it came to Grad Plus eligibility. This system was really critical in ensuring that students could fully finance their education within the federal loan framework and the protections for borrowers and incentives for practice in underserved areas that it provided. As many of you may know, this structure changed significantly under the One Big Beautiful Bill Act. The legislation passed last year in July phased out Grad Plus loans for new borrowers beginning July 1st of this year. In its place, it created new borrowing caps for graduate and professional students to ensure that they had access to the level of aid necessary to complete their programs. For non-professional graduate students, the limit that Congress provided was $20,500 annually, along with a $100,000 lifetime cap. And then for professional students, Congress provided higher limits at a level of $50,000 annually and a $200,000 lifetime cap. In addition to these annual and lifetime loan limits, Congress also instituted a lifetime borrowing limit of $257,500 for all federal loans, which is inclusive of borrowing at both the undergraduate and graduate or professional level. So within this new framework, the central policy question became who qualifies as a professional student, because that designation will now determine access to whether or not students have the necessary level of loans that they need to complete their education. So in recognition of that question, Congress addressed the eligibility for professional student loans directly in the statute that it passed. The law instructed the Department of Education to use the existing regulatory definition of a professional degree that was in effect at the time that the law was enacted. As you can see here, that definition focused on three core elements: completion of academic requirements for entry into a given profession, a level of training beyond a bachelor's degree, and then typically a requirement for professional licensure. The definition that Congress cited in OBA also provides illustrative examples that would qualify for professional degree status, like medicine, dentistry, pharmacy, law, and others. But an important and critical point in this debate is that the definition is not limited to just those listed professions. The intent of Congress was clearly to rely on a functional definition rather than a closed list, as evidenced by the examples language and the language bolded that says that the examples include but are not limited to those that are listed. I'd also flag that the list that Congress cited includes both doctoral and master's level degrees, indicating Congress's intent that this apply broadly rather than just being limited to doctoral level professions. However, during negotiated rulemaking that was designed to implement the bill in November, the Department of Education proposed adding new criteria that go significantly beyond what Congress included in OBA. Specifically, the new criteria that the department instituted were a requirement that programs be at the doctoral level and that they fall within certain classification of instructional programs or SIP codes that are aligned with the listed example professions that Congress cited in OBA. These additional criteria have a significant exclusionary effect. So they exclude professions that would otherwise clearly qualify, like PAs, nurse practitioners, nurse anesthetists, physical therapists, occupational therapists, and a number of other professions that are critical to our healthcare workforce. So, in other words, the proposed rule narrows eligibility well beyond what Congress appears to have intended when it passed OBA. In terms of where things currently stand procedurally, so once the Department of Education held its negotiated rulemaking sessions in the fall, they then proceeded to a public comment period, which ran from January through March of this year, and we're now currently awaiting a final rule from the department. PAEA, as well as a broad coalition of stakeholders, including the attorney generals from 24 states across the country, has argued that the department is exceeding its statutory authority by imposing additional requirements for professional student eligibility beyond those that were found in the law. At the same time, though, Congress retains its ability to clarify its intent and ensure that the statutory definition is implemented as written, which we've been advocating with policymakers to do over the course of the past several months. So with that in mind, that brings us to the most targeted legislative response currently available. This is the Professional Student Degree Act. It was introduced by Congressman Mike Lawler in December. Right now, as of this morning, it has 10 Republican co-sponsors as well as one Democrat. And this would directly address the issue that we're concerned with today. The bill explicitly names a number of professions that are currently at risk of exclusion under the department's proposal, including PAs as well as advanced practice nurses, physical therapists, occupational therapists, audiologists, and a number of other professions as well. PAEA has endorsed this legislation as a narrow practical fix that makes Congress's intent in the One Big Beautiful Bill Act more clear while retaining access to the level of aid necessary to prepare a high quality healthcare workforce. Beyond the Professional Student Degree Act, however, there are also a number of other proposals that have been introduced to fix this issue since the department's negotiated rulemaking sessions in the fall. So, a bill led by Congressman Tim Kennedy of New York with 60 Democratic co-sponsors, H.R. 6574, the Loan Equity for Advanced Professionals Act, would eliminate the distinction between graduate and professional students entirely and provide all students with access to the $50,000 annual and then $200,000 lifetime limits that are available via OBA. In addition to the Congressman Kennedy bill, a bill led by Congressman Richie Torres and Senator Angela Alsobrooks would restore full access to Grad Plus loans, which would also address this issue. So while PAEA has been monitoring both of these bills and both of these would address the professional student issue that has been raised, we have at this point chosen to endorse the Professional Student Degree Act, given its targeted nature and that it preserves the structure Congress created while correcting the implementation issue. So that's kind of the legislative landscape as we see it now, as well as the federal student aid system and its importance to PA programs. So with that background in mind, I'll go ahead and turn it over to our next presenter, Aaron Woodall, to provide an overview of the structure and costs of a typical PA program.
Yeah, thank you, Tyler. Like you said, my name is Aaron Woodall. I am an assistant professor at a PA program here in Little Rock, Arkansas. I also graduated from this program as a PA, so kind of have that experience as a student and now as faculty. And so I'm going to talk a little bit about how our PA program is structured. The data that I'll be using is specific to my program, but again, can be kind of generalized to other PA programs across the country that are structured pretty similarly. Next slide. So our admissions requirements for entering into the program, we require students to have at least a bachelor's degree or a higher level degree with a minimum GPA of 3.0. We require 41 hours of science prerequisites. This includes things like biology, anatomy, physiology, genetics, chemistry, psychology, and statistics. And we also require at least 500 hours of direct patient care. This can be things like being a paramedic, nurse, medical assistant, patient care tech, respiratory therapist, just some sort of job where our students have had hands-on experience with patients. With all of this, our program remains highly competitive. Our last admission cycle, we received over 600 applications for just 40 seats. And again, this is pretty typical for PA programs across the country that are seeing high levels of interest in their programs. The structure of our PA program, it's a 2.5 year full-time master's level degree that consists of 128 credit hours. This is significantly more credit hours than your typical master's level graduate school. Most non-professional grad programs may have 30 to 60 credit hours, but again, we incorporate 128. This is broken into the first phase, which is a 13-month didactic phase where our students are in class full time. They're taking 18 to 21 credit hours per semester. They're expected to be in the classroom from Monday through Friday, 8 to 5. On top of that, they have additional requirements like completing patient encounters, where they go with a PA mentor in the community and are seeing hands-on patients. They also complete community service learning requirements and participate in our student-run free clinic. During the clinical phase, this is the second 15 months of the program. They complete 10 core rotations in core disciplines that are assigned, that are 5 week long rotations. They then complete 2 elective rotations where they can learn in any discipline that they're interested in, and these are 3 week rotations. During this time, they're expected to be on site, either in the clinic or in the hospital, for at least 40 hours a week. On top of that, they're of course studying for their end of rotation exams, prepping for their upcoming boards exams, and also completing a capstone research project for their master's degree. Because of this high intensity of the program and the time commitment that we know is required, we do not allow our students to work while they're enrolled. And so because of this, many students have to rely on federal aid to cover not just their tuition and fees and direct cost of attendance, but also their cost of living. And so a little bit about our PA program curriculum. So again, the first didactic phase is that classroom. The first semester that they start, they take 11 credit hours, at least 11 credit hours of foundational sciences, including things like physiology, pharmacology, anatomy. They then, over the course of the program, have 46 credit hours in clinical medicine. And so learning the medical skills, pharmacotherapy, and then specific disciplines like behavioral medicine, surgical medicine, emergency medicine. And then they also have 6 credit hours of research-based courses like evidence-based medicine, where they're learning to participate in clinical research. During this didactic phase, they also have laboratory instruction where they have a human cadaver anatomy lab. They can learn physical exam techniques and also clinical skills such as suturing, joint injections, casting, splinting. Then during the clinical phase, that second 15-month of the program, I mentioned that they participate in 10 different core rotations that are 5 weeks each. And you can see this list here, behavioral medicine, emergency medicine, family medicine, pediatrics, surgery, all of these disciplines. With this, they're in several different settings like outpatient clinics, inpatient floors, emergency departments, and the operating room. They complete technical skills such as giving injections, performing pelvic exams, suturing, and being a direct first assist in surgery. Next slide. Cost of attendance. This is our upcoming cost of attendance for our cohort that will matriculate here in just a few weeks in May. The total program tuition and fees is calculated at over $58,000 for in-state students and $86,000 for out-of-state students. This is for the entire 28-month program. These fees include covering lab costs. Like I mentioned, they participate in the cadaver labs and things like that. It also covers personal diagnostic equipment that they're provided at matriculation. So things like their stethoscope and otoscope that they need while they're on rotation, and also paying for standardized patients that we use regularly for assessments to see how the students are doing. Outside of these direct costs, there's additional costs. So the required textbooks and technology that they will need for school is estimated at over $3,700. Health insurance, which is required while they are enrolled, is estimated at over $3,600. And then, as I mentioned, cost of living, we have to estimate for. Again, our students are unable to work while they are enrolled. And so many students, myself included when I was in school, have to take out loans that help cover these costs. And so this is estimated at about $35,000 a year. So our total cost of attendance, accounting for these costs of living and other indirect costs, is over $143,000 for in-state students and $171,000 for out-of-state students. Some additional costs that vary per student, but some things that we have to kind of take into consideration and we talk to students about when they're evaluating their budgets and their need for federal aid. When they are placed on these clinical rotation sites, there's sometimes fees that are outside of the control of our program. And so the hospital or the health system that they may be rotating at may require that students complete additional background checks, drug screens, credentialing fees, doing TB testing. And again, these are kind of hard to predict sometimes because we don't know until the student's placed at that site what they may require. And so sometimes these incur some out-of-pocket expenses for these students. We place students in clinical rotations around the state, and these could be up to 3 hours away from our main base campus in Little Rock. Our program is really fortunate that our university provides housing for any out-of-town rotations, and we don't require students to directly pay for clinical site placements or pay their preceptors, but this is not the case for all programs. Some programs across the country their students are subject to covering their housing and their living costs while they're out of town. However, for our students, because they may need to travel to sites, they're expected to have reliable transportation. At the end of every rotation, they have to return to our main campus for an end of rotation seminar. And so they're expected to be able to travel, like I said, sometimes these long distances. And so they may incur those travel costs. And then after graduation, before students are working as a PA and they get that first paycheck, there are additional costs that they need to be prepared to cover. And so this includes paying for the PANCE, which is our national board certification exam, paying for any preparatory resources that they need to prep for that exam, and initial state licensure fees. And so when looking at our students that receive federal aid, this number has increased every year over the last 3 years. In our most recent graduating class of 2025 that graduated in August, 68% of those students received federal aid. For our upcoming class that will graduate this August, 78% of them receive federal aid. And for our currently enrolled didactic class that will graduate in 2027, 85% of them are receiving federal aid. Really importantly, looking at all of these last 3 years, for every student that needed to take some amount of federal aid, they all borrowed the maximum amount of their unsubsidized loans, so that $20,500 per year limit. And 100% of those students that needed any sort of federal aid had to borrow at least a portion of Graduate Plus loans. And so again, showing that the students who are needing federal aid to help cover the costs of the program aren't able to do that with just that $20,500 limit. And with that, I will turn it over to Justin.
Thank you so much. Good afternoon, everyone. My name is Justin Nelson. I am currently a clinical year PA student at Keck Graduate Institute in Claremont, California. I'm currently on my pediatrics rotation as we rotate through all the different specialties, learning everything, and I'm enjoying it so much. I want to thank Mike, Tyler, and Aaron for laying out the incredible value that PAs bring to the table, the mechanics of how federal student aid works in our profession, and also the structure of our education. My goal for the next few minutes in front of you guys is to put a human face to the policies and numbers that we're talking about here. And I want to share exactly what it took me to get into PA school, how we survived through it financially, as Aaron was mentioning, and what could happen to the future of our workforce if we lose access to the right federal funding. Next slide, please. Mike mentioned in his opening remarks of how critical the PA pipeline is for expanding access to care. But that pipeline is not exactly an easy one to enter from the beginning. And for many, it's financially daunting even before they enter PA programs. During my undergrad studies, I worked full-time in the hospital and doctor's offices to get my patient care hours to even be eligible to apply for PA school. I was also working at McDonald's on the weekends to save up money, flipping patties, making nuggets, and just doing what it took to even afford the application process. And even then, I still relied on federal loans to cover my undergrad tuition expenses. The barrier of entry to the PA profession is pretty steep, and I had to scrape together between $1,000 to $2,000 for each application cycle just to be eligible, let alone get into the program. But as Aaron was mentioning, because the field is so competitive, the demand is there, but the seats are so few, it took me 2 whole application cycles to finally get that acceptance letter. And that's the level of grit and financial sacrifice that myself and many other PA students require before we even get into our PA programs. Next slide, please. As Aaron mentioned, he explained the average 27-month, very accelerated medical model that we go through in our PA education. And he noted that program policies generally prohibit us from working, which is exactly true for most programs as well as mine because of the accelerated nature. As a student, let me tell you what that policy actually feels like on the ground. That means for over 2 years, my income is very much zero, actually negative. And while the average tuition of PA programs in the United States is just about $90,000, like Aaron was also mentioning, that doesn't include any of the living expenses, rent, groceries, insurance, gas to drive to rotations in school. And so the financial need is much greater than just that. Tyler did a wonderful job of outlining how the federal student aid structure works. And right now, I am completely dependent on those Grad Plus loans that cover the cost of attendance, including living expenses, so I don't have to worry. Those Grad Plus loans are truly the only reason I can go to PA school at this point, so I can survive financially and just focus on what matters most in my PA program, which is learning to be a safe and effective healthcare provider. Next slide, please. Tyler also noted how the One Big Beautiful Bill Act changed specifically the $20,005 annual limit for non-professional graduate students, which is what PAs would be lumped in before this final ruling. And so that limit would be just a complete disconnect from the reality of PA education. It would not even cover half of a year of tuition, let alone cost of living for me and many other PA students across the country. Having access to these federal loans gives me peace of mind. And like I mentioned, it allows me to focus on my studies. And many of the protections that the federal loans provide also give peace of mind, such as fixed interest rates, access to income-driven repayment at the end of my studies, and also the option for public service loan forgiveness if I so choose. If I was to be capped at $20,500, I would not be able to go to PA school at all. I would be forced to choose a different profession. And if I chose to pursue the PA profession, I would be limited to taking out private student loans, which do not offer the same protections that these federal loans do. That would mean variable predatory interest rates, strict repayment plans, and zero federal protections or options for forgiveness. Next slide, please. Overall, this brings me back to Mike's opening remarks about the desperate need for healthcare providers in both rural and underserved areas. And we are currently at a huge workforce shortage, especially in these high need areas. And we cannot address this shortage with these student loan limits, dampening the PA pipeline. When students are overwhelmed with private loans with no forgiveness options, no protection, they simply can't take these primary care jobs in rural America. Often students are forced to look for just the highest salary, and because of that student loan burden and the need to pay them off as quick as possible. Passing the Professional Student Degree Act really isn't just about protecting students like me, it's also about protecting the patients that we're training to serve and keeping this profession accessible to people from all backgrounds. Thank you for listening to the student perspective today, and I'll hand it back to Tyler for some key takeaways in our Q&A session.
Great. Well, thank you so much, Justin, for sharing your story. So to close, before we turn to Q&A, I just wanted to highlight a few key points. So First, as we discussed earlier in the session, there really is bipartisan recognition at this point that restricting access to financing for particularly post-baccalaureate healthcare professions that are licensed would disrupt the workforce pipeline at a time of growing demand and significant shortages across the country. Second, HR 6718, the Professional Student Degree Act, is a narrowly focused, targeted fix for this implementation issue that has significant bipartisan support and is faithful to congressional intent. And then just to close with our ask, if you represent offices that have not yet co-sponsored HR 6718, we certainly encourage you to do so. This is a very time-sensitive issue given that the loan limits are set to go into effect on July 1st, and this can be one of the strongest shows of support that Congress can provide for the future of our healthcare workforce. So with that, I will go ahead and turn it back to Catherine to get us going with Q&A.
Yeah, so as we're waiting for some additional questions to come in, I had a quick question submitted for Aaron. When you were covering the additional cost slide, are those amounts included in the previous cost of attendance slide or in addition to?
So those would be in addition to, because they're going to vary a little bit per student based on what rotations and what sites they're placed at. And so they're not directly included in those direct or indirect costs in the tuition and fees.
Okay, great. Thank you for clarifying that. We got another question. As a pre-PA student, what can I do to help get these bills passed?
Yeah, I can jump in on that and share a couple of things. So, right now, PAEA is running a campaign through our grassroots action network, urging providing a platform for students and faculty and any outside stakeholders that are interested to really urge their members of Congress to support the Professional Student Degree Act. Again, while direct legislative advocacy is very important. PAEA is also happy to partner with folks in strategies to continue to raise awareness through op-eds, targeted like constituent engagement with legislative offices through like in-person meetings and things like that. So those are just a couple of ideas of how to get involved.
Great, thank you. So the other question we received, as we are currently awaiting the final rule, do we have a timeline for when we will receive the final rule? Tyler, I'm gonna turn that one over to you as well, since I know there's been some variation in what we're anticipating there.
Yeah, so the Department of Education has signaled that the final rule will be released in the coming weeks. Our understanding is that the rule must be released by June 1st for the loan limits to take effect by July 1st. So we will likely see additional word from the department on this in the coming weeks.
Yeah, so as we wait for a couple of more to come in from attendees, I just wanted to ask a few of my own, at least, if I can squeeze that in. So for Aaron, how do you see the professional student issue impacting the applicant pipeline for your program?
Yeah, so I mentioned we are, pretty highly competitive and we receive a lot of applicants, but we have had several internal discussions. We anticipate that number to decrease pretty significantly if this does take effect. We also expect that it may limit our students coming from rural or underserved backgrounds, which is areas that, we want to encourage. We want to include students from rural areas in Arkansas because part of our mission is to try to increase the health workforce in Arkansas. So we want to be able to get these students and then keep them here in the state. But if they are from areas that they, don't have good other, support for their cost of attendance, these students often rely on federal student loans to fund that. And so again, yeah, we do anticipate that we would see a significant drop in our applications.
Okay, great. Yeah, thank you. We did just receive another question. So how do we co-sponsor the bill? I have been sending out emails from various organizations that reach out to us about this, AAPA, PAEA, etc. Is there something else we can do?
Yeah, assuming this is coming from a congressional staffer. So if you want to go ahead and follow up with me, my email is tsmith@paeaonline.org. I can put you into contact with the lead staffer in Congressman Lawler's office on this, who's kind of coordinating the co-sponsor effort. In terms of additional things that congressional staff and members can do, we definitely encourage folks to reach out to the Department of Education directly on this. Issuing public statements is always very helpful. Reaching out to the White House to the extent that that's feasible for you is certainly helpful. So, in addition to like formally co-sponsoring the bill, just continuing to raise awareness about this issue broadly is incredibly helpful.
Um, is there an advocacy location with language suggestions at PAEA online and ability to communicate with our state's federal legislatures? I am sure there is, but having a difficult time locating it currently.
Yeah, so a couple of things. If you take a look at the campaign on our Grassroots Action Network, that provides both an overview of the issue as well as like key talking points that you can either send directly through that platform or use in other contexts. So that's definitely the like first place that I would point you to. I would also flag on PAEA's website. We publish our public facing like statements and like letters that we send to members of Congress as well as executive agencies. So to the extent that you kind of want to flag kind of what PAEA is doing, I know AAPA does something similar. I think that can also be helpful in kind of like informing the way that you communicate with policymakers.
In a worst case scenario, if the bill fails to pass, do you have any suggestions for PA programs on terms of what they can do to help students?
Yeah, a couple of things. So certainly making students aware of the non-loan financing options that are available to them. So I know a number of employers are offering kind of like scholarship programs as well as kind of like the National Service Corps and other kind of like traditional sources of scholarship support. So I think first maxing out the non-loan based options of financial aid that are out there will be the first step. I think we've kind of highlighted the dangers that are surrounding private student loans. In some cases, if students have, strong credit backgrounds, co-signers, that can be an option for some people. But that would naturally be kind of like the option of last resort. So the other piece that I would mention is that we're starting to see some states respond to the federal government's pullback in terms of federal student aid options. So I would advise you to check to see if your state is pursuing an option of setting up a state-based loan program for students. While that wouldn't, naturally provide access to like certain federal benefits, it would likely be an option that's better than private loans. That we would definitely encourage folks to explore.
Yeah, so I had another question for Justin. Um, how would being classified or not as a professional student have affected your financial planning for PA school?
Thanks for the question, Catherine. Yeah, as I previously mentioned, it would have been a hard roadblock for me to even consider the PA profession, even though I knew that I had shadowed PAs, I had worked with PAs, I knew that I was falling in love with the profession from day one. I knew that there would be those huge financial burdens and roadblocks for me. So I would have had to perhaps consider different professions um, or take on like we were mentioning private loans, which I may or may not have even been approved for with being a young undergrad student with limited credit history. So it would have significantly impacted my financial situation.
Yeah, thank you for making that point as well, particularly with the credit history as well. So would this classification, another one for you, Justin, just building on that, impact future students' decisions to work in underserved areas after graduation?
Absolutely. I think the two areas, like Tyler mentioned, the National Health Service Corps, if I mean that would remain a pipeline. However, those resources are very limited and have been even more limited especially after the COVID-19 pandemic. And so those numbers of students that are in that pipeline has uh, dramatically decreased. And so if students are faced with private student loans where they need to pay them off as quick as possible with higher, the previous concerns we discussed about private student loans. Um, Students will be forced to chase higher salaries and perhaps away from rural and underserved communities that desperately need PAs to address their healthcare shortages.
Yeah, for sure. Not something we want to see. Um, can you, and this is, I guess, for any of the panelists, can you address the future medical professional pipeline challenges that will arise when fewer students enter the job market?
Yeah, I'm happy to jump in and kick it off. So, as I mentioned, kind of like at the top of this, we are in a time where we're facing significant workforce shortages across the country, even when we have, pretty significant demand to enter the PA pipeline now. I think at last count, nearly 100 million Americans live in a primary care health professional shortage area. That's at a time where all of these, resources in terms of federal student aid are already existing. So if you're significantly cutting off the pipeline, and you have students in a situation where they may not have the credit history or like the family connections to be able to even qualify for a private student loan, we would naturally expect to see some attrition in the pipeline and the applicant numbers that we see over time. So from all indications, this is going to significantly decimate the both the pipeline and then also worsen the access to care issues, particularly in rural and underserved areas that we're already seeing.
Yeah, to echo that, in Arkansas, in a rural state, almost every single county is designated as a primary care shortage area. And so like Tyler said, we're seeing that issue, even though we have a high interest in the profession right now. And so if we see that drop, and see decreases in that pipeline, then we're going to just continue having the shortage areas and worsen them.
And I'll add a little bit. It also changes the type of applicants that apply. And the people that we're trying to meet into the rural and underserved areas will lose that application pool and will super subspecialize, which will further the gap, I believe, as well, just to add that on.
Is there any move to address this differently, or any thought in decreasing perhaps cost for education?
Yeah, I'm happy to jump in on this as well. So, when Congress was considering the One Big Beautiful Bill Act, this was an area where there was significant thought and attention to the delineation between graduate programs and like what are traditionally considered as professional programs. I think Congress demonstrated an understanding in the initial law that, especially in health professions education, there are certain structural costs that are inherent to providing the education. So, the cost of clinical placements, the cost of lab equipment, having to pay competitive salaries to faculty who often make more in clinical practice than they do in academia. Um, so I think, Congress recognized kind of like the fact that those structural costs exist. So I think, from my conversations with institutions across the country, they're committed to doing everything that they can to contain costs for students. But a lot of the costs that are charged are, inherent to providing a health professions education and aren't so much within the control of the institution. Beyond kind of like the direct costs as well of providing the education, there are also costs that are entirely out of the realm of control of the university. So, housing expenses, food expenses, et cetera, for students. So I think what you will likely see is efforts by institutions to contain costs where they can. But the key thing to understand is that programs cost what they do for a reason, and a lot of those costs are inherent to the type of education that PA students get.
This is a Tyler question. Has PAEA also collaborated with other health profession associations like AACP and AOTA to enhance awareness and combine resources?
Yeah, a couple of things that I would highlight. So I would again direct folks to our statements and testimony page where you can get kind of like a full sense of the coalition work that PAE has been engaged in on this front. So we've worked with a number of coalitions like the Federation of Associations of Schools of Health Professions, of which many of the groups that were listed are a member. In terms of AOTA and the occupational therapists specifically, PAEA is also a member of the Advanced Professionals Workforce Alliance, which is advocating on this issue. The coalition was brought together specifically because of this concern. So yeah, there's really kind of like an all hands on deck cross-professional advocacy response to this concern.
Yeah, and I guess on the subject of other health professions, I think this could be good to highlight. But I'm wondering if you could speak to how significant the funding gap for PA education is if PA students were classified as graduate students in comparison to like the other health professions as well.
Yeah, happy to jump in on this. So, typically, what we see at PA programs across the country is that tuition and fees tend to be in the neighborhood of about $75,000 at public programs for residents. It exceeds a little over 100,000 for private programs. That's not inclusive of some of the costs that Aaron talked about in terms of like living expenses, housing, food, transportation, things like that. So, I would say in a world where PA students were classified as graduate students, the cost of attendance would be significantly beyond what would be available through the federal student loan system. If they are ultimately classified as professional students, that comes significantly closer to covering the cost for most PA programs across the country, though some programs may fall outside of the caps. Um, in terms of other health professions, so the professions that face similar gaps to PAs are most notably nurse anesthetists, uh, physical therapists are also in a similar boat, and then nurse practitioners as well. So those are really kind of like the professions of greatest concern from, like a a cost gap perspective from what's being proposed as being available through the federal system and then what it actually costs to provide the education.
Looks like we've answered all of our questions. Oh, maybe I spoke too soon. Okay. We did get another one. So, do we know the way these new caps were determined by the Department of Education?
Yeah, a couple of things. So, the department is generally seeking to adopt as narrow of a definition of professional student as possible. So, under its proposed rule, it would be limited to just the list of enumerated examples that I mentioned in my section, plus clinical psychology. Um, a couple of things. So the exclusion of PAs as well as nurse practitioners and a number of the other professions was talked about extensively during negotiated rulemaking. When the department put out its proposed rule, it provided a rationale for PA exclusion that was focused on scope of practice, which we responded to. We don't think that that has a legal basis, given that the criteria Congress mandated were clear. But basically, the central argument that the department has made is that because PA practice is tied through like collaboration and supervision agreements in the majority of states, they don't think that the law allows them to be classified as professionals. We've responded to that argument extensively, and I definitely direct you to the comments that are available on PAEA's website on how we think that that doesn't align with the statutory requirements for professional student status.
I'm going to give it another maybe like 30 seconds to a minute just to see if any other questions do come in. Doesn't look like we're getting anything else. I just want to end this by just thanking everybody for participating in today's briefing. And also, if you have any questions on PAEA's advocacy efforts, please don't hesitate to reach out to me directly. My email is cmajeski, Majewski at paeaonline.org. And from all of us at PAEA, we wish you well, and we'll see you next time.